who's able to pay for these medications? Who's going to be willing to pay $1,000+ a month if they can even find the medication in pharmacies?
What boundaries you put in place, what controls you put in place. This is health we're talking about here, right?
I think there were over 100 deaths of people because of the contamination of these products that they were distributing. And that raised concern about using compounding pharmacies.
Health is very serious. You need to understand what is going into your body, right?
With a little health and a little wealth and a lot of love, that's a life that we live. Suits and scrubs.
Red.
Hello, everybody! Welcome to another episode of Suits and Scrubs. A little bit of health.
A little bit of wealth.
And a lot of love. Join me is my beautiful co-host. She looks stunning. If you guys are not watching on YouTube, you're missing out. She got them cowboy boots on. Looking good. M.A. She's online. She is double board certified internal and obesity medicine. She's also exploring functional medicine. I think your courses are due at the end of this month.
Yes,
don't remind you.
I've been delinquent. I need to watch some lectures this week.
Well, this is the person, when she says she's delinquent, she said that in her obesity medicine and literally sat through a weekend and was top 98%. Yeah, she kicked me because she doesn't want me to tell and brag on her, but I am going to do that because that's just my personality and that's her personality.
So I am joined by my very enthusiastic and energetic co-host, Mr. Zachary SVP. If you don't know him, he is our finance guy. He has managed over $1 billion to date, and he has reached his Coast Fire number, and he's growing out his mustache right now, looking like an old cartoon bandit.
Well, it's funny. Your sister said, like, I'm robbing a train.
Yeah.
It's so funny. All the guys like it, all the girls hate
dastardly,
it.
yes.
Yeah, so I guess it's not. It's kind of the opposite of what I was going for.
It's the Penelope Pit Stop villain.
It's just like the same thing with if you get real bulky, all the guys, oh man, the gains. The girls are like, it's kind of weird, right? All right, guys. Well, the title of this episode, actually, this is pretty serious. A very trending topic. One of our videos right now is trending, so we want to give some more information around this. So it's Ozempic Craze, the truth about compounding pharmacies. So this is probably new to some of you guys. Like, what is compounding pharmacy? How to do this safely, and ultimately making sure you understand you're educated before you just get something from anyone and just inject it into your body. Health is very serious. You need to understand what is going into your body, right? So we have our first segment, which is very relatable to this topic here.
Refactions. There's actually around 7,500 compounding pharmacies all over this country, and they can fill highly specific prescriptions for all sorts of reasons. Maybe you're having trouble swallowing pills. They can make the same drug in liquid form. Maybe you need a drug in a lower concentration than what's commercially available. They can do that for you. So they do very important work, and it is not just humans that benefit.
There are no manufactured medications made for birds. So you need to go to your compounding pharmacist so they can make the right volume, because it could be large, medium, or small. Each one might like a different flavor or require a different volume. She likes pina colada flavor.
Honestly, I thought it was an advertisement because I wasn't on my premium YouTube account. I looked at it and I was shocked. We got to react to that one. So that's a good one.
So,
and I love how you made it lighthearted this time.
I mean, we have to. We talk about all this serious health stuff. I think it just shows, and I honestly think that video was from not even within the last year. I think it was from a few years ago. So
it said 4 years ago on the thing.
Yeah, it just shows that compounding pharmacies have been a matter of debate for years and years. But I think it has become more of an interest just with the craze with the Ozempic and Wegovy and Zepbound with the weight loss medications. And it's become part of a pop culture now to talk about compounding pharmacies. And it is hugely debated on both sides. And so we're going to dive deep into the history of compounding pharmacies today. And I'll give you both sides, but I'll tell you where I stand as well.
Yeah, awesome. Can you really get a compounded pharmacy pina colada flavor?
Apparently you can for your birds.
Wow, interesting.
Mind and money matters.
So the next segment we have is Mind and Money Matters. Perfect for this because we know how expensive these medicines can be. So why don't you break it down for us? And again, guys, I don't know anyone who knows more than this than you. So you may be getting a lot of information out there. You are double board certified. You're so close to this because you actively help patients with this today, you know, in primary care physician, as well as, you know, other things as well. So go ahead and talk about this.
Yes, this is my bread and butter. And I enjoy treating obesity medicine. I enjoy weight management. And this is probably the most controversial topic right now in obesity medicine, which is unfortunate. But we will talk about.
Well, you want to tell people why you like helping people with weight loss? Maybe just take a minute and do a side story, personal story.
I mean, I've always struggled with my weight personally. I've had a hard time when I was in junior high, which I think is the hardest time to be overweight, really. For girls in your formative years, when there are bullies, people are savage in junior high and they make fun of you. And so I've always had, I would say, body dysmorphia, body image issues, and have always been so hyper focused on losing weight. But it wasn't until I really started learning about nutrition and exercise science and exercise physiology when I was an undergrad that I had a healthier picture of weight loss.
Right.
And so I can understand why people are so upset about these medications right now, because they're acting like everyone's using it as a magic bullet.
Right.
And I like to look at it more holistically, use it as a tool while also empowering people to make healthy choices and figure out what those choices are, because there's so much information out there that it's hard to know what the right recommendations are.
Yeah. And then maybe we should do an episode on the controversy about Ozempic, like the vanity purposes versus the health reasons. You know, here we only talk about the health reasons, really, because that is what we do. I mean, you're an MD. I think maybe we should venture into that, because we got a lot of dialogue in our YouTube comments on our first episode of Ozempic that's trending right now that we wanted to follow on and just kind of provide more information and just kind of dive deeper into this topic. So and I appreciate you sharing about your body dysmorphia. And when I tell people that, people look at you like, what is she talking about?
Well, I know it can be a slippery slope too with these medications, because you want to make sure that you're using them in the right way and that people don't have eating disorders, or you're not using them in a way to kind of perpetuate those problems. So I think having that background too, and being cognizant of that, and making sure that people still have a healthy image of themselves. It's a tightrope walk with these medications. So I like to try to make sure people are using them safely.
Exactly. So so let's go through the costs of this.
We can talk initially about the cost of the brand name medication. So the brand name weight loss medications right now are Wegovy and Zepbound. I know a lot of people are familiar with the Ozempic and Mounjaro, but those were technically the brand names that were meant for treatment of diabetes, so not necessarily just for weight loss. So these medications, they have become more and more popular over the last 2 years, and we're in a shortage right now. And so I think it's a combination of not having enough and insurance companies not wanting to kind of foot the bill of these medications, but the access is just really difficult for a lot of people. And so the cost of the medications, the cost of the Wegovy, Mounjaro, Zepbound, the brand name medications is at least $1,000 a month, which is crazy to think about, that 4 doses of medication, because they're weekly injections, can cost that much money. And sometimes it's more than that, like $1,300
I'm sure
a month.
It doesn't cost that much money to make this medicine. Like there has to be no way.
Well, I know there's a lot that goes into that.
Yeah, but I know there's a lot of research, and I'm ignorant in this. And if you are listening and you know a lot about this, drop some comments. Like, I want to get some dialogue started here. Like, why is it so expensive?
And I'm sure some of it's they spend a lot of money on the initial research and the clinical studies, and they're trying to recoup some of that money.
That's right.
I understand that. And the mechanism of pushing a button and having the injection, I know that's part of it too, is having that patented. And and having the mechanism of injecting the medication, not just the medication itself.
Which is not as painful as the other was. By the way, I am on it. I've been trying it. I've been trying to lose 65 pounds. I guess we talked about this in the first few episodes. And people look at me and say, why are you on it? Why are you on it? But no, I like 30, 40 pounds. Right now I got my laundry basket tucked into my jeans here, you know what I mean? So, it was hard for me to lose. I gained a whole bunch of weight in COVID. I was 315 pounds. I'm down to 270, and I still cannot lose the last 25, 30 pounds. And so my insurance approves it. Like my weight management doctor, I just had issues with my ghrelin hormone, which is in my stomach.
Well, you haven't tried to refill it yet, because I'd be interested to know if you can even get and we'll talk about that more. But so the cost of the brand name medications out of pocket without insurance coverage is at least $1,000 a month. And then sometimes insurance won't pay for it, but the manufacturer has a coupon and you can use the coupon, but guess how much it is even with using the coupon?
How much is
it's $550 a month.
That's a lot better than the $1,000.
I know.
So guys out there, you're paying $1,000. There's a manufacturer coupon out there.
Well, if you're eligible.
You're eligible. Oops.
And
What's
it only
eligibility?
you have to have, I think, commercial insurance, and it only lasts for a certain number of months. So what happens when you stay on the medication, you start the medication, it works really well for you, and then all of a sudden the manufacturer coupon runs out and you're going to have to pay at least twice what you were paying before.
At least we're trying to help you guys. I did not know a manufacturer coupon. Has that always been around?
So I can't remember if they had one initially for the Wegovy. I think they did, but this has been more the manufacturer coupon, the Eli Lilly manufacturer coupon for Zepbound and for Mounjaro.
Gotcha. Not for Ozempic.
Yeah, I can't remember if they had one or not, just because the manufacturer coupons that I'm familiar with have been more the Zepbound.
Is there any differences between the names of the medication? It's just the same thing, but just different names?
Well, the Novo Nordisk is who came out with Ozempic and Wegovy, and so that's semaglutide is the main ingredient, the name of the main ingredient in that medication. And then you have the other pharmaceutical company that came out with Mounjaro and Zepbound, but they market it for different things. So initially, Ozempic was what came out, and that was for diabetes, and then Wegovy is what came out afterwards, and that was strictly for weight loss. So if you didn't have diabetes, you could still use it for weight loss.
Right. Interesting.
So it's all semantics, really. That being said, the Mind and Money Matters portion of this, I think it's also important to think about who's able to pay for these medications, who's going to be willing to pay $550 a month or $1,000+ a month if they can even find the medication in pharmacies.
Right.
And does this further increase that gap of healthcare disparities?
Right. That's a good point. And I think we're practitioners here. So I tried to get through my primary care doctor, and then my primary care doctor worked through my insurance and all that, and it was not approved. And so I went to a BC medicine specialist here locally. Pretty reasonable consultation and all of that. And it took 5 weeks first to see what we had in stock, and went all around about. But eventually,
I know what it entails because I was doing this for my patients for the last couple of years, even before. So I knew how to try to find it for you, which a lot of people don't already have that background.
Help people.
But it's
how do you find Ozempic? How do you find these GLP-1 medications? Go.
So, and honestly, you really can't right now, but at least, so Zepbound was the newest one to come out. It came out earlier this year, and we were having shortages with Wegovy for months and months. We could not find the starting doses of Wegovy anywhere at any of the local pharmacies. And at least here in Charlotte, and I think in a lot of other places too. But when Zepbound came out, everybody was like, oh, give me the first prescription because I know the pharmacies are going to start having it in stock and it's going to run out too. And so that's eventually what happened. But insurance also makes it difficult because they will say, we have a preferred pharmacy that you can get it from. And so if insurance does finally, your provider has to fill out a prior authorization form, which your obesity medicine specialist did to make sure that you met the qualifications for it. And so then insurance says, yes, we will cover it. And then once they cover it, they say, but we're only going to cover it if you get it from pharmacy X, Y, and Z. So you have to go to this pharmacy to get it, or you have to get it at mail order, which they didn't have it in stock at any of these at the main pharmacies.
Right.
But they did have it at some of these mom and pop pharmacies.
Right.
But I'm sorry, we're not going to cover it at those mom and pop
Insurance
pharmacies.
didn't cover it,
It's
yeah.
going to be $1,300 out of pocket for you to.
Right.
So it's constant jumping through hoops
Right.
for.
And we managed it it was like a project. Like every single, it was almost daily. And so if you guys want it, like this is what we recommend. Like go through those.
And
Now-
this was before. Now everything's on shortage, and so now even if insurance covers it, you can't find it anywhere.
Yeah, which we'll report back if we can find it. We will report back. I think it's important for us to understand if we can get it or not. So yeah, but the thing is, with the long-term costs of other ailments associated with obesity, like I'm sure that doesn't even come close to the cost of these GL1P.
Yeah, there are newer
medications.
studies coming out now to show the cost savings of using a GLP-1 and preventing or decreasing some of these associated health conditions. There's a significant cost savings there. I mean,
Right.
if you're paying for the medication up front and you're helping someone lose weight versus if you're paying for end-stage renal disease or heart failure management down the road.
Right. We talk about compounding pharmacies in general and retail. That's the whole title of this episode. So a lot of people are, like, man, it's such a craze right now. And I'm not going to expose anyone, but I know, like, we'll do a whole episode on this, like some diabetics that are in our friend group or whatever. I was with this individual and their mother reached out to him and said, I'll buy your leftover Ozempic. Like, let me have it. And he's just like, no, it's like, I need it for my diabetes. Yes, I have excess, but like, I don't think it's healthy, mom, you know what I mean? So, but this is not, I've heard other stories like getting from your hairdresser or doing this, doing that. I mean, it's, so let's go ahead.
It's a wild, wild west.
It is wild, wild
out
west,
there.
but let's just don't go through that right now. Let's just talk about what the difference is between the retail and the compound.
Retailer pharmacies versus compounding pharmacies. If you think about it, back in the day, in the early 1900s, every pharmacy was a compounding pharmacy. Basically, you had pharmacists that were mixing up the concoctions and medications right there at your
Concoctions
local.
just sounds so like.
Well, at your local apothecary, your local pharmacist did all of that. That was their job, and so nowadays you can't really do that because there's so many medications, so many different medications, so many different dosages. It's not as simple as it was back then. And you have your retailer pharmacies, which are like your CVS, your Walgreens, your main pharmacies that they don't necessarily, they don't make the medications there. You have manufacturing facilities that make the medications in bulk and then will send it to the pharmacy. And those manufacturing pharmacies are FDA regulated. There are strict regulations there. And then the retailers will sell the prescriptions or sell those medications. Whereas compounding pharmacies can individualize prescriptions for the patient, and they can change them in some way. They can change the form, whether it's a pill or a tablet, change it to a cream or
A lot of flavor like the bird.
they can change the flavors. They can help in a lot of ways. They can help with chemotherapy medications. Magic mouthwash is another thing that technically is a compounded medication because you're using a bunch of different
Magic
ingredients.
mouthwash?
It's a mouthwash that has like an anti-yeast or an antifungal, and it also has lidocaine, it has an antacid, and it's something that we use a lot for cancer patients because cancer patients they'll have like inflammation or they'll have irritation of their mucosa or their gums, and that's something that you can swish around in your mouth and you can either spit or swallow, and it gives them a lot of relief. It can.
Wow. So guys, I was today years old, Charlotte, North Carolina. It is 11:30 here. We do film these later because this is a recorded date night. But we want to know where you're watching it from, like what country. But have you heard of Magic Mouthwash? Let us know what time, and this is new to you or this is not new to you. Let us know what time that you have learned about Magic Mouthwash. I was today years old at 11:30. I'm married to this, so it's a lot of today years old with me. Anyway, go ahead.
So Magic mouthwash. I mean, there are a lot of benefits from compounding pharmacies that we've been using for years and years. And the other thing would be changing the methods of use. So if someone, they can compound a bunch of different pain relieving medications or analgesics, as we call them, into a compounded cream. And so you can, instead of having to rub a bunch of different types of creams to one area, it's all compounded into one cream.
Okay.
Or for kids, for example, they can't take a pill, they can't take a tablet or a capsule. They need it in liquid form, and it might be more palatable if it's a flavor. So compounding pharmacies can make things in liquid form that have a flavor to them, like our friends parrots were appreciating too.
Yeah, that's crazy. I did not know that. So why are compounding pharmacies so controversial right now? I guess, well, before you answer that question, I guess I don't mean to answer this question for you, but when you say that they can measure, they can do things individualized, what boundaries you put in place, what controls you put in place. I mean, this is health we're talking about here, right? And so, yeah, so like what are the controversial, like why is it so controversial?
Yeah.
Because they've been around forever is what you, sorry, is that the punchline?
Yes. I mean, they've been
1900s.
around, but there's also been a lot of controversy for years surrounding compounding pharmacies too. And so this isn't something new, but I think it's being sensationalized, it's being brought to the forefront because of this Ozempic craze, because of these weight loss medications, because a lot of people are turning to the compounding pharmacies to make these medicines. And that's where a lot of people are getting them right now, because the drug is on such shortage. You can't find it in any of the pharmacies. People can't afford it. Insurance isn't covering it. So I think that's why it's become more of a hot button issue.
Right.
But
people can't afford it. Well, is compounded cheaper? Did we talk about
yeah.
that?
I mean, compounded pharmacies can make it, and I've heard, I am a part of a lot of obesity medicine groups, and a lot of people have speculated that part of the supply chain issues with making more of Wegovy or Zepbound or Mounjaro or Ozempic, part of the issue is the contraption, the pen. It's hard to mass produce these pens. Not just the
It's just plastic. I don't understand that.
Well, I think that's part of the issue with the supply chain, which we're having issues with a lot of medication shortages. It's not just this, but it's such a popular medication.
I feel like shortages has been something like very, I'm not saying the word trendy, but since the COVID, like I feel like when we go to the grocery store, it's like a crapshoot. Like, will they have Canadian bacon, which I love. It's a lot healthier than bacon, and I'm not giving up bacon, sorry. Like, things like that, like eggs, like, but like shortages have just been like a new norm.
Yeah, it was like any store that you went to.
Because it didn't used to be that way.
If you went to get a coffee at Starbucks, if you went to a coffee shop, they're like, we're out of this, and this because we can't, It's in every industry.
I wonder if it's a new norm or something.
But it gets scary when it's pharmaceutical,
like, right?
Especially when it's something that's life changing or life saving. If it's something that you really need,
right? But
so part of the controversy is just with these weight loss medications. The other controversy with these compounding pharmacies, there is kind of like this tie to aesthetics, because also compounding pharmacies are the ones that maybe do some of these creams or anti-aging creams, or are the ones that supply a lot of bioidentical hormones to different med spas. And so I think there's this connotation that, people are using these compounding pharmacies because all they want to do is make themselves look younger and look better, and they're putting their health at risk for vanity. And so there's that agenda out there that's kind of putting the compounding pharmacies in a negative light. There was definitely some bad press back in the early or mid 2012. There was a huge issue with a compounding pharmacy that was up in the Northeast in Massachusetts that was supplying a steroid injection that doctors or that clinicians were injecting. They were doing epidural injections, and it was not sterile. And so I think there were over 100 deaths of people because they ended up with meningitis because of the contamination of these products that they were distributing. And so that really opened the eyes of a lot of people, a lot of regulatory agencies, and really raised concern about using compounding pharmacies, because compounding pharmacies not only distribute to the individual, but also to different healthcare facilities and hospitals sometimes too. And so it really raised safety concerns.
Yeah. Wow. I did not know that about that. And was that recent?
That was in 2012.
2012. Okay. So do you think that there'll be any more rules or regulations coming with compounded pharmacies with FDA? And
I think that was a big change, and there were a lot of different regulations that were put in place
already
because of that. And then you have these different designations, the 503A and 503B pharmacy designations. So 503A designated pharmacies, they're regulated by the state.
Okay.
The state
so there is regulations
pharmacy
involved.
boards.
Okay. I'm over here thinking like they're over there just like, building concoctions and doing their thing, like Walter White in the damn desert, Breaking Bad.
Mm-hmm.
But no, that makes sense. I mean, duh. In order to be a pharmacist, you have to be regulated.
Yeah,
Okay.
but you think staffing shortages too? They're of these regulating agencies of people who are actually going in and making sure that these pharmacies are abiding by those rules. Sometimes you don't have enough people to go around to actually be testing and checking to make sure that they're following guidelines and following.
True.
So
That's
I think that's the other criticism.
Pitfall, yeah.
But these pharmacies, and I think if they're big enough pharmacies too, that the other designation is this FDA regulation, the 503B pharmacies. If you're going to mass produce a medication, especially if you're going to be shipping it to patients or to facilities across state lines, there's a new designation, 503B designation, where the FDA is involved, and they are having to use more stringent and strict regulation guidelines. Yeah.
Gotcha. Now, this is really good information, and I honestly don't think, like, we watched a few specials on this already, right? And it was more scare tactics than anything else. I know you being behind the curtain, that's what we're trying to do here, being behind the curtain to look at these types of things, because you have a lot of experience in this. Again,
some of these areas or some of these avenues that people are getting their semaglutide or their tirzepatide is not from a 503A or 503B pharmacy. It is from, it's overseas. They're ordering it online from people where you don't actually know where you're getting it from.
Ooh.
These semaglutide salts that are not proven to be safe or are ineffective or not safe for use. And you hear it all the time, people going to med spas or people going, and not saying that all med spas are not using compounded medication safely, but you can get it from anywhere now. And,
right.
and where.
So guys, ask if it's what, 501B?
Or just if it's coming from a 503A or 503B pharmacy.
503B.
If it's coming from a state-regulated pharmacy, is it coming from an FDA-regulated pharmacy?
Okay.
Because that makes a big difference.
Yeah, and we say this in almost every episode. Here at Suits and Scrubs, we give advice, based upon our experiences, and we're experts in these spaces. So you can ask better questions. Mm-hmm. These are the questions you could ask better on.
And it's unfortunate that things happened like the meningitis outbreak.
Right.
But I do feel like if you are a reputable compounding pharmacy, that makes you stand at attention a little bit. And I think a lot of these pharmacies also have their own regulatory agencies, or they're trying to ensure quality control. But
yeah, this is a good segue into our next question. Do you think it's safe? Do you think it's a safe alternative?
I think it depends on where you're getting it from. If you're getting it from a reputable pharmacy, and the FDA does have kind of some resources where you can check to see if a pharmacy is regulated by the state. And I think Be Safe RX is one of their campaigns where they're also making sure that people are aware of a list of questions or things that they should be asking, or red flags if a pharmacy sends you something and the label has your name, it doesn't have your name spelled correctly, or it doesn't have the medication name spelled correctly, or if it's in a different language, or if it's in a syringe that doesn't have a label on it. Like, there are all these things where they're trying to educate patients. Like, this is not safe. You should not be getting,
because anyone should be doing
because
that.
you can order anything online now, as I'm sure you're aware. You can find anything online, and there are all kinds of scams out there.
Right.
Trying to take advantage of people who are desperately trying to find these medications.
Right.
And they're just taking their money. They're sending them medications that don't have active ingredients in them, that might not be safe.
Right. But we're getting on to so you do believe that compound pharmacies, if done correctly, so you would recommend that?
I think it is a way for patients to get the medication right now, because you can't get it anywhere. You can't get it in any of the commercial pharmacies. And if that's really the only alternative. And there are some people who have, the other thing that I've seen a lot of times too, is that initially when Mounjaro came out, there maybe the guidelines were a little bit looser, and there were more insurance companies that were covering it for weight loss, not just for diabetic patients.
Right.
And so there are these people that maybe had pre-diabetes or that just had obesity that started these medications, and it was life-changing to them. They were able to lose this weight, and then all of a sudden their insurance that the next month was like, I'm just not going to cover it anymore. And so what do you do in that case when you've found something that was so effective and you can't find it anymore? Or if you do find it, you have to pay $1,000 a month to get it. And I think it's better to find it from a safe place, find it from a reputable compounding pharmacy that does have regulations in place, versus going on the black web and finding a dangerous.
A lot of people do that. Like, a lot of people used to do that with, the craze like 10, 15 years ago was like Viagra and Cialis. No one went to the doctor. They're too embarrassed to ask for that. And, instead of actually going, they would go and over, sometimes it wasn't effective. Sometimes it was these damn gas station pills crunched up, and you don't want to do that.
But the other thing too is, if you think about just the world that we live in with supplements, with herbals and supplements, those aren't FDA regulated either. And so you just have to be really cautious. And that's the biggest criticism to these compounding pharmacies, is that many of them don't have strict FDA regulations. Pick your poison.
Yeah, you do. And the thing is, it's better than just getting it from your hairdresser. So you can ask these questions to make sure. And I wonder what the cost difference is between like a compound pharmacy versus the $1,000 it is. Like, do you know off the top of your head?
I mean, if it's better, if it seems too good to be true, it usually is. So if they're offering this
$100,
hell of a deal, then it probably is not.
You just cursed the first time on our podcast? Woo! Go ahead.
But a lot of times, compounding pharmacies are able to provide it at a cheaper cost, at a more affordable cost.
That's true. That's why it is so attractive. So it makes sense to make sure you understand, the health, the benefits, the risks, and all that involved, which you just very clearly laid out. Yeah. I didn't know that.
Well, we were watching that. It was like an ABC special talking about how.
Honestly, guys, can I say something before you go there? I didn't even know what compound pharmacy was. Like, I didn't know that was the thing. I really didn't know that. But that's like, I'm so far away removed from medicine. Like, that's probably like a dividend, to me. Like, oh, you say dividend? What else the dividend? It's the same thing probably for you. Like, I didn't know what that is. So it's not as common knowledge as you think.
Well, I think it also, they talk about how these pharmaceutical companies are suing. They're suing these different compounding pharmacies. And is it legal? Is it illegal for them to be creating this version of a medication that they just came out with?
1900.
Technically, when there's a new brand name of medication like the Wegovy or Ozempic or Mounjaro, you can't take somebody else's intellectual property and then just cut the cost and then distribute it to everyone and make millions of dollars off of it. But there are some changes to regulations whenever something is on the FDA drug shortage list, because it's no longer commercially available because you're not producing enough for the consumers. And so
Wouldn't that suck if you're Ozempic and then you created this wonderful product that's been out for a while, and then they just discovered, like, I don't know what the history is behind this, but they discovered it's great for weight loss.
Yeah.
You spend all these hours and hours of research, money, bam, you knock it out of the park, and it's like it's you didn't even expect. You wake up one day like, oh my gosh, like I'm on the Ozempic lottery, you know what I mean?
Yeah.
And then you can't make enough of it to meet the demands, and so all these other little grubby little I'm just kidding, they're not grubby, but the little pharmacists are compounding it, and then your formula, and you're like, oh.
And I can understand also, because it is the Wild Wild West, and you have all of these non-reputable pharmacies or like people in their basements creating this semaglutide and tirzepatide for public use when there's an increased risk of side effects and dangerous outcomes, and they don't want their name to be put on this medication that wasn't really their FDA approved medication.
Yeah, that makes sense.
It was something bootlegged that they have no control over, but it's giving them a bad reputation. Yeah. And that's what they're calling. They're calling compounded versions of these medications bootlegged Wegovy or bootlegged Ozempic, which I think sometimes they are, but other times I just don't think that reputable compounding pharmacies should be given such a bad name for coming up with a solution to get the medication out to more people.
Yeah, that makes sense. I think I know what our thumbnail is going to be. It's probably going to be bootleg Ozempic ? So people are like, what is that? So can you speak any more reasons about the lawsuits around the pharmacies creating weight loss medications? Anything else you want to punch up there?
I mean, those were the main things. I think the other thing to consider too is make sure if you're getting compounded medication that you have a healthcare provider who is administering it or who is giving you information, because that's the other thing. It's not coming in the FDA approved pens. Typically, if you're using a compounding pharmacy, it comes in a vial, and you have to know dosage, and you have to titrate in a certain way. And so it's important for you to have a provider who is with you every step of the way that can talk you through it. And it's still such a controversial topic, because I know there are some obesity medicine specialists out there. I'm a part of the Facebook group that just get like blue in the face. They're so upset about compounding pharmacies creating these medications, where you also have the other half of obesity medicine specialists who are like, this is such an effective medicine and I want to be able to provide it to
divided. It's a house divided.
It is.
So it's a house divided. Emily, you take a stance. What is your position on this?
I am for using compounding pharmacies that are regulated for distribution of these medications.
So you're for it. So 503B, 503A. Ask the question, guys. So y'all heard
but the other thing too is there are providers who are using these pharmacies, but they're not appropriately managing the patients. Like it shouldn't just be on the pharmacy. It should also be on the provider who's prescribing these medications, making sure that they're aware of the potential side effects, that they know what outcomes are expected. And that's the other kind of
little
tidbit I would.
But the thing is, but you are for it, so that's where you are.
I think
ask the right question.
I have seen patients. And it breaks my heart, because I will have someone come into me that says it's not only helping their weight loss, it's helping their joint pain. It's helping. It's helped reduce inflammation to where one of their autoimmune conditions is no longer bothering them anymore, and they can play with their kids. And they're so terrified, they're in tears, because they have been able to get this medication reliably for the last year or the last 2 years, and it has absolutely changed their life. And then not only is their insurance not covering it anymore, but they're to the point they're so desperate. I will pay $1,000. I will use my tax return money. I will. They will find some way to pay for the medication, but they can't find it anywhere. They can't find it anywhere.
So, honestly, so we talk about this, we talk about bootleg, we talk about pina colada flavor, but let's get real. Now, I'm sorry, I got chills when you said that. That's a real good story, because I feel like if it's unavailable, then what other alternative do they have? They're going to pay for the full price. They just want the medicine because it has changed their life so much. I think that's powerful.
Yeah, I think in mainstream media, we see all of this. We see the Kardashians, we see Oprah Winfrey, and all these people who are using the medication for vanity and improving their waistlines, but you don't see the other side of things. You
Yeah.
don't see the human people that are benefiting from this in other ways of just losing weight.
Losing weight, exactly. And it's crazy because I just had this whole conversation with someone who actually was prescribed Ozempic. Dad had open heart surgery or whatever, and I did not know it was really good, or bypass, I don't remember, but I did not know it was really good for your heart as well.
So many parameters that are coming out now talking about sleep apnea and diminished sleep apnea on these medications.
Yeah.
And I mean, it all makes sense because it's helping you lose weight. And these are all obesity-related
ailments,
syndromes,
or was it
comorbidities.
Ooh.
But
we said that in the last episode.
But there is a new indication for cardiovascular for people who have coronary artery disease. It's another indication for using these medications. So it's no longer just diabetes and weight management.
You
It's
look
also
so hot right now. I'm not even gonna lie.
it's also indicated for heart disease.
I don't know if you guys are not watching our YouTube, y'all need to be. But I get a little. I think intelligence like that is so sexy. She's so passionate over there. She's like, sorry, I'm just gonna brag on my wife a little bit. This is a recorded date night, and by the time you watch this, like, it is midnight for us here on Saturday. This is how we spend our Saturdays now, helping you guys find this information. But no, I think this is a hot topic, and I think we definitely need to make sure this information is out there. So thank you, Em, for sharing all your wisdom, all your knowledge, and taking a stand on this controversial topic. Anything else you want to leave everybody before we peace out?
I think that's it.
Okay.
That's all I got for today.
That's all you got? All right, a little bit of health, a little bit of wealth.
Lot of love.
All right, guys, until next time. Bye.
Bye.
He's on the hustle, she's on the grind. There's no time to kill. We're saving lives and new deadlines, and there's some holes to fill. With a little health and a little wealth and a lot of love. That's a life that we live. Suits and scrubs.